Assalamu alaikum. In this video, we will be talking about the uptake, the synthesis, and release of a neurotransmitter. And for this video, we will be talking about acetylcholine. So, first of all, the first step, that is the rate determining step, is the uptake of choline. And that choline binds with the acetyl CoA, forming acetylcholine. And the enzyme is CH80, that stands for what? Choline acetyl transferase. So this acetylcholine gets accumulated in the synaptic vesicle. This is the synaptic vesicle. When the presynaptic membrane, this is the presynaptic membrane and this is the postsynaptic membrane. So when there is depolarization of the presynaptic membrane and when voltage gated sodium channels get opened, this causes the synaptic vesicle to fuse with the presynaptic membrane and causes the release of acetylcholine. And when this acetylcholine gets released in the synaptic cleft, and further it binds to the cholinereceptors present on the postsynaptic membrane. And all of this acetylcholine binds temporary for few minutes or for few seconds, and acetylcholine is then degraded by the action of the acetylcholine esterase enzyme and is converted into choline acetate, and this choline is taken up by the presynaptic membrane. So you have to remember at which level which drug is acting and interfering with the synthesis or release of the acetylcholine. See, hemicholium is the drug that inhibits the uptake of choline, right? And vasamicol is a drug that inhibits the uptake of acetylcholine or their storage in the synaptic vesicle. And botulinum is really important drug that inhibits the fusion of synaptic vesicle with the presynaptic membrane and inhibiting the release of acetylcholine. And botulinum toxin is really important because it is used for cosmetic surgeries, inhibiting the release of acetylcholine. Then we also sometimes use acetylcholine esterase enzyme to degrade the excessive acetylcholine. And we do use acetylcholine esterase inhibitors to increase the levels of acetylcholine in the patients of myasthenia gravis. We will talk about it later. So that was the end for the synthesis and release of the acetylcholine, and now we will be talking about the noradrenergic. One more important thing is acetylcholinesterase inhibitors can be reversible and irreversible. And they are used for the treatment of multiple diseases, for the diagnosis of some diseases. We will be talking about all of the drugs in a later video. Stay tuned.